So first, I mean, what we learned from all of these first rounds of clinical trials, that for some hematological malignancies, like the B-cell derived, like some leukemia or non-Hodgkin's, we saw incredible complete response rates, which was for the field, and some of them are curative. And for people that are not familiar really with that, you have to understand these are extremely aggressive leukemias, and the patients have just weeks to live, basically. They've been trying every single rounds of existing drugs, some of them experimental, nothing works. And then you put them on CAR T cells and their tumor can be wiped out in 2 weeks. And you look at their bone marrow, you look where the tumor is in the blood, and so you don't find the tumor. This is what we call MRD negative, meaning that there is no molecular testing available that is sensitive enough to find tumor in their body in 2 weeks, right? So I think this was the game changer, and that's why people are now investing so much money in the field, and there are so many companies starting that, because this was unseen. This was like a change in paradigm of what we could do. And so that's really one of the lessons we learned. And now it has been, for the clinically approved CAR T-cell product, it has been reproduced at a larger scale.
Yeah.
So that is the bright side. Then in terms of the limits, so first we've seen, and depending on the clinical trials and depending on the indications, between 30 and 80% of these patients that had a complete response relapse. And in the B-cell leukemia world, it's more about 50, but in the myeloma world, almost all of them are relapsing eventually.
Yeah.
And so right now there's a lot of research trying to understand why these patients are relapsing, and we start understanding a little bit more. And some of the reasons is that first there's some tumor escape where the targets that was targeted by the CAR is being either mutated or it's expressed at low levels. And the CARs, we start also understanding that CARs have limits in their capacity to detect low antigen densities. And there are some levels where they can simply not kill, and there are some in-between levels where they can still kill, but as a result, these T cells takes them so much effort to kill them that they tend to exhaust and die really, really shortly after. So this is one of the issue, and so right now, I think we're going to talk about it a little bit later too, but we were trying to develop strategies to improve T cell persistence and T cells sensitivity to low antigen densities.